Hello, it's 12 noon, so we're going to get started. Welcome to today's virtual program hosted by the Healthcare Council of Chicago. My name is Megan Phillip. I am the Executive Director of HC3, a member-led coalition of healthcare leaders and organizations that are influencing change in our local communities. Today's program features healthcare and policy experts for a discussion focused on the federal perspective of the state legislation and policy as part of our ongoing transformation series. Before we get started, there's a few housekeeping items. This afternoon's discussion will be recorded and shared on our website, www.hc3.health. So if for any reason you have to take a pause, leave us a little bit early, you can always check back later for that or share it with others post-event. As we hear from today's experts, if you have questions, please use the chat function, which we will be seen directly by our panelists. So we will do our best to address those during the audience Q&A. And now, without further ado, I would like to welcome our panelists to turn on their videos to join us virtually. Stephanie Altman is the Director of Healthcare Justice and Senior Director of Policy at the Shriver Center on Poverty Law. She directs the Shriver Center's work to uncover systemic inequities and create new pathways for opportunity through legislation and system changes. She also directs the organization's healthcare advocacy, representing clients, individuals, and class actions related to healthcare equity and advocating for accessible healthcare through administrative and legislative forums. David Smith is probably a familiar face for many of you. He is the CEO and founder of Third Horizon Strategies, a consulting firm that provides strategic planning, intelligence sharing, and collaborative problem solving focused on shaping a better system of health. He is also one of our co-founders of the Healthcare Council of Chicago. Vikki Wachino is the former director and for the Center for Medicaid and CHIP Services and Deputy Administrator of CMS, and is currently the CEO of Community-Oriented Correctional Health Services. She's worked for over 20 years to advance strong healthcare policy for low-income populations. In addition to our incredible panel of experts, it's my pleasure to introduce HC3 member Dave Johnson, who is not only the CEO of Foresight Health, but an author, speaker, and thought leader in the world of health. Over to you, Dave.
Great. Thanks, Megan, and welcome everybody. Well, we certainly live in interesting healthcare times. I've started to think of COVID-19 as healthcare's Pearl Harbor. We'll never think of the healthcare world the same way after COVID as we did before. It's clearly straining resources. It looks like we're in for a very dark winter. At the same time, very positive news on the vaccine front. And honestly, the global effort to bring a vaccine to market in such a short period of time is maybe the greatest human undertaking of all time, when you look at the number of companies and resources and the scope. But that's coronavirus, just one of many things on the healthcare front. The ACA is in front of the Supreme Court. The Biden team has assembled a very impressive coronavirus task force and will appoint a coronavirus czar in the administration. We're still waiting to see when the transition will start. That's capturing more than the attention of just a few people. We're still digesting election results. And then last but not least, and this is something I'm only really learning myself, and so not many people have heard of, is that the Fair Care Act, just introduced by Representative Westerman and Senator Braun, both Republicans, is the first serious attempt I've seen to build on the ACA and use market-based mechanisms to bring universal insurance coverage to the United States using market-based mechanisms like exchanges and so on. And gives me hope potentially that we can drain the emotion from the healthcare debate and actually move forward to talk about what I think both sides ultimately want, which is better healthcare for more people at lower prices. So anyway, lots to talk about and a great panel to talk about it with. And I'm going to let them each give an opening statement. We gave them all of about 3 minutes notice on this, so you're going to be just overwhelmed by not only how articulate and knowledgeable they are, but how quickly they pulled their statements together. So Stephanie, why don't you start, and then we'll go to Vikki and then David.
Thank you. Thanks, David, for lowering the expectations on my opening statement.
It's my job.
Thanks. So hi, I'm Stephanie Altman. I'm the director of the healthcare team at the Shriver Center. Shriver Center, we represent low-income communities in Illinois seeking racial and economic justice. We advocate for health equity, which redressing disparities and health disparities primarily through the expansion of healthcare coverage, and that's often Medicaid, but also coverage through the Affordable Care Act. As I mentioned in our prep session, I'm a big proponent of Medicaid. I'm very pro-Medicaid. We look for equal access to providers. So while we don't work representing providers or provider systems, providers are very integral to our communities being able to get access to care. My hopes for looking forward is to stop the Affordable Care Act sabotage and to start reversing it at the federal level with everything that the Biden administration might be able to do. Also to address racial equity, which I think is the real issue that's facing all of us right now, and something that the federal government and the state governments can really make a big difference. And to reverse the attacks on immigrants and start to reverse those restrictions, which have been extremely painful for our communities and have been a big barrier to healthcare access. Thank you.
Great. Thanks, Stephanie. Vikki?
It's great to be here with you, and thanks, Stephanie, for getting us off to such a great start. I think my starting place is a gratitude that we have such a strong base of healthcare coverage in the United States, thanks to the ACA. And that is a huge asset at all of our disposal as we confront the pandemic and as we try to address the fallout from the pandemic, whether that's the fallout from the economic fallout, where Medicaid is playing a huge role, as are the exchanges in backstopping loss of employer-based coverage, the benefits to public health of people having coverage, the benefits to behavioral health of people having coverage. So I think it's great news for the health system that we are where they are. As we all know, there are opportunities for improvement. Healthcare coverage was a major issue in the election. Affordability of coverage is a major concern to many Americans. And there is a lot of opportunity going forward to strengthen the healthcare system, including, as Stephanie notes, reversing some of the damage that's been done administratively over the past 4 years. I think the questions facing the healthcare system are, political questions facing the healthcare system are, where do we go from here? Are we finally going to move to a place where we can get some consensus around the value of coverage to people? It's a question, I think, that faces congressional leadership, and obviously questions coming out of the oral arguments around the latest legal challenges to the ACA that took place last week. In the meantime, job one of the healthcare system is COVID, COVID, COVID. Every part of the healthcare system has a role to play in addressing pandemic response. On the other hand, every part of the healthcare system is suffering strain as a result of COVID-19. And so moving back to the policy, I think we have huge unanswered questions from Congress about what the federal response to COVID could be. And if you look at the history and trajectory of 2020 as a policy response, we had really strong congressional and administration action at the beginning of the year, followed by nothing, in the second half of the year. And so I think, the key question for everyone is, where do we go from here in terms of the public health response and in terms of the economic response to COVID? The last thing I'll say is, I think there are opportunities as as Stephanie notes, I think over the past year, we've asked ourselves as a country questions around racial equity that we hadn't confronted or asked ourselves so squarely before. And now the question in front of us is really, how do we bake that in to the healthcare system? Many of us in the policy level have operated from the perspective that our healthcare system operates as a race neutral proposition, and it doesn't. And I think that's been really clear over the past year, including, looking at the racial impacts of COVID, but not limited to it.
Wow, that's a lot. David?
Yeah, thanks, Dave. And appreciate everybody that jumped on. This is the first time, I think, in an HC3 meeting I've actually been a panelist. So I'll do my best at trying to switch roles. For the introductory remarks I wanted to make, there's 4 quick topics I just want to breeze through. One, I just want to lay out some assumptions about the world we're entering. 2, I want to just reference a couple of things about what that world is going to look like post January 20th. The third is the environment in which that world will operate. And then I'm just going to outline a few of the things that I see at the federal level that I think will be big policy drivers in the coming months and years. So let me start with assumptions and just tick through these quickly. Assumption number 1, I don't know how much of a foregone conclusion it is at this point or not, but I'm assuming that there's going to be a transition of power, a peaceful transition of power. But it's going to be messy. And I think we've seen in recent days, and I think we'll continue to see a bit of an intransigence from the current administration to the incoming administration that really could create a bit of a delayed start, which could be problematic for a range of reasons, one being COVID. Second assumption is that these the COVID and economic fires that are really rekindling and progressing and accelerating as we speak will burn well into the summer months, despite how quickly we manufacture a vaccine or even provide some of that aid through packages that Vikki referenced. It will take time for that to work through the system. And so any new normal, whatever, I know everyone's probably tired of that phrase, doesn't happen for several months. And the third assumption I'm making is that the ACA does endure the challenge in the Supreme Court. I know that can be a jump ball, and I know nobody should take much into Roberts and Kavanaugh's public comments during the hearing, but there is a reason to believe that the ACA probably has a stronger chance than not of making it through this challenge. If it doesn't, just disregard everything else I'm saying, because the whole world looks maybe a little bit more problematic. So what does that world look like? Well, we've got a few really core challenges as we transition into January. Medicare insolvency date is now set for 2024. That's a big issue. It means the next administration will be in office during the period that the Medicare Trust Fund is expected to be insolvent. You can bet that becomes a political issue the closer we get to that date. Second big challenge, state budget climate. For Illinois, we had a call on this a couple of weeks ago where we had Senator Staines on, and she said, look, because the fair tax didn't pass, we're staring down the barrel of a $6 billion deficit in Illinois. Like, this is coming at a moment where people need more funds, not $6 billion in budget cuts. That becomes deeply problematic for our state. Other states across the country are going to be facing a similar budget climate. It's going to be all hands on deck trying to navigate that. And we're going to be dealing on the back end with kind of a financially battered delivery system. If you believe the Kaufman Hall study that was done a few months ago, the delivery system is going to take a $320 billion hit because of COVID. $150 billion of that is offset by CARES. But we're walking into an environment now where we don't know if we'll see a suspension of elective services or other implications to hospital systems as a result of COVID. The environment in which all this is taking place is trickier still. I think on the one hand, there's no clear governing majority. You can argue that's good or bad. I'll stay out of the ideology. There's certainly no clear path here for driving a full progressive agenda. Even if the Georgia senatorial races go in the Democrats' favor, there is not a clear referendum, and the margins for big policy are going to be razor thin. There are major changes, as you all know, to our social compact, the way we live, the way we recreate, the way we see our doctors, the way we think about our own care. We don't know the full extent to which our social compact has shifted, and that will be against a backdrop of new policy. There's a deeper, I think, antipathy right now for government institutions. I think we have seen a wholesale erosion of confidence in public health that's been wrought by a bunch of different factors. Restoring that confidence is going to be a Herculean task for a new administration in a highly and politically charged environment. That said, call me an optimist. I think there are potential areas of some partisan compromise, certainly more than we've seen in the last 8 years. Biden is a creature of the Senate. If he governs the way he says he's going to govern, I think there is a pathway to some moderation in partisan interactions, but it's still going to be a really ugly environment as the deeper right and the deeper left really continue to bear down on their positions. Last thing I'll say here, biggest policies, 5 things I'm thinking about watching for: double down on the ACA. I think take Joe Biden at his word. I don't think you're going to see a Medicare for all bill. Margins aren't there, culture's not there, politics aren't there. It'd be hard to push it through. 2, I think continue to see this administration drive the interoperability initiatives that this administration put in place under statutory authority for cures through the Office of the National Coordinator and CMS. I think number 3, we'll see, Dave, like this, I think continued pushing of value-based payments. The degree and the sophistication of that will be somewhat contingent on who's installed at the department and CMS levels of leadership. But I don't think count CMMI out unless the ACA is overturned. Telehealth parity is number 4, obviously a big one. And price transparency would probably be number 5. Bit of a jump ball as to what the Biden administration would do. Hard to see unraveling that, even under pressure from hospitals. Might see an extension or kicking of the can on those regulations. I don't think there's a lot else that can get done politically after all the dust settles. So Dave, that was a lot. I probably went over time, but that's why I'm never a panelist at my own party.
Yeah, well, we understand this is a process for you, David, and we're compassionate and we're gonna work with you on it. So it's good. Well, let's talk a little bit about the election. And David just did a nice job of I think summarizing in coherent way kind of some of the tensions. But what I've been wrestling with is one, the voter turnout, which was unprecedented, and the fact that Joe Biden won more votes than any other candidate for president ever, and the second highest vote getter was Donald Trump. Actually won 7 or 8 million more votes than he did in 2016. And when you look at it, Biden won roughly 500 counties that represent 70% of the GDP in the United States. And just the math means Trump won counties that were about 30% of the GDP. And so we clearly have a kind of reshuffling of the working class vote to some extent. And I'm just curious, as you're looking at this from all your perspectives, political, health, equity, and so on, is the Republican Party becoming essentially the working class party? And do the Republicans have the wherewithal to acknowledge that and maybe do some progressive conservative populism to take advantage of that and push benefits to that group that's clearly suffering, don't think the government's working for them? And then you've got the corporatist side of the Republican Party. So maintaining that Trumpism coalition, even if Trump isn't there anymore, pretty tough. And then on the Democratic side, a very urban orientation, obviously having to placate their donors that are more affluent, more educated, more tech savvy, and a fairly aggressive, populist, almost socialist wing on the Bernie Sanders AOC wing of the party. So what are we looking at? Are we looking at a fundamental shift of sort of politics in the United States and coalition? Does one party have a chance to emerge as a sort of a governing majority? We seem to have at least as of the 2020 election, a split decision. So I don't know who wants to jump in there first on that, but it's a really intriguing moment. Maybe Vikki, why don't you start, since you were on the front lines at the last election? So.
Well, David, I can see as moderator, you're not inclined to start with the easy questions.
Oh, yes, I am.
You mean it only gets harder?
Yeah, forewarned is forearmed, right?
I mean, look, we're a deeply divided country. I'll start with good election news, in my view, which is like the actual mechanics of the election were incredibly strong. Like there was a lot of worry just a few weeks ago about the potential for disruption and even violence in the elections process. And then you had DHS come out last week and say it was actually really smooth. And that's corroborated by my own personal experience. I actually went on election day and worked as a poll observer in Pennsylvania. And before I left, I had friends calling me saying, do you really want to do that? Are you taking too much of a risk?
Oh, good for you.
And I am happy to report that it was the most boring 14 hours of my life. It was totally smooth. Everything went really well. And I think it's, I don't think that my experience was unusual. And I start with that because, just a few weeks ago, we were worried that our basic cogs of democracy might not be turning smoothly, and they are. Right. So that's the good news, is like maybe we are a little more stable as a country than it might have seemed earlier in 2020. The harder thing is what you're pointing to, which is we are really, really divided. And it's a little hard right now to see what is the governing coalition. I'll say for myself, as someone who spent way too long in Washington, so I am, one of those people who is like, who just by definition is not that popular, just by virtue of the amount of time I've spent here. I mean, it is exhausting to go from poll to poll, POLE, not POLL, right? And when I talk to other people on both sides of the aisle who spend a lot of time on health policy, I think there's a real interest in moving beyond the fights around coverage. And we have really serious issues in the healthcare system, whether it's long-term care, whether it's how we move forward with behavioral health services. And every time that we get stuck in the ongoing debate about the future of coverage, are times we're not tackling issues that really matter to people. So I'm hopeful that at some point we get unstuck. Similarly hopeful, as David notes, that Biden is a part of unlocking it, because he does have a real history of reaching across the aisle. But there are obviously really serious divisions, and the key to unlocking it is not obvious to me sitting here today.
Yeah, cool. Megan? No. Oh, I'm sorry, Jessica. Stephanie.
Oh, sorry.
Yeah.
Thank you. No worries.
No, that was my fault. I don't know. You have nothing to apologize for. I was the idiot.
That's why Megan, our moderator. So yeah, I mean, I agree with Vikki. I'm not a political expert, and I don't know how to, other than smart people I read, I don't know more about the divisions. I do think it would be interesting to dig deeper into these demographics. I think that the term working class often ignores voters of color. I think it's been used as an overall term in the last 4 years, definitely to define or to represent a group of mainly white, non-college educated, and often men, but also women. And that's not the only working class. And so I think that they need to dig deep, there needs to be a deeper dig into immigrants, into communities of color, into Black and other communities who also comprise the working class. And it's not all dependent on exactly what somebody's current income is, because often in communities of color, especially in Black communities, as you may be aware, economic inequities often are based on generational structural racism. So even if current income and college education may be higher in a community, when you dig deeper into the equity issue and the income inequality, there's much less of a safety net there and based on structural racism, not having that kind of income in families, generational, and in real estate. So I think I kind of bristle a little bit on the working class issue being a Republican issue. What I would also say is—
But you did see increasing numbers of Latinos and African Americans voting for Trump too, which surprised a lot of people, and also shows that anytime we put a blanket moniker on a large complex group, we're bound to have mistakes. So
definitely, and that was my next point. Not all communities of color voted as a block. And when you look at immigrant communities, especially in Florida and Texas and Arizona, as have been pointed out, and especially among Latinx and Hispanic communities, but as well among Asian American communities, Vietnamese communities, as you dig deeper, they definitely, there's definitely been some change in terms of voting. I think the most important thing, I'm not an expert in terms of who people vote for, but the Affordable Care Act provisions are still incredibly popular when polled.
yeah.
And so I think it's the issues, like Vikki said, that really bring people together more than draw them apart. There are a lot of charts you can see, a lot of places you can look, but when you poll on each individual provision of the Affordable Care Act, much of it is extremely popular across all communities and political parties. And so I think that's where we can reach, hopefully, some consensus.
Yeah, good. Great points. David?
Yeah, well, I'm grateful that Vikki and Stephanie went first, because it gave me a second to think a little bit about this. I've been thinking a bit about this alternative universe where the president had made some different decisions, and those different decisions would have changed these thin margins in big ways. Not going to war with John McCain would have shifted how Cindy McCain approached Arizona, probably would have put that in Trump's favor. You're showing a modicum of empathy when John Lewis died could have turned Georgia in his favor. Not kind of implicitly celebrating the plot against Governor Whitmer in Michigan could have turned Michigan. Charlottesville, the comments made in Pennsylvania about, I wasn't going to come see you folks before COVID, and now I have to come here. I don't want to be here. I mean, these are little marginal things, but they kind of matter. And one of the things that is so important to think about in this election is Republicans did really well. Yeah. The president didn't do well. And what does that tell you? It tells you that there was a lot of down bad. This is not some stirring raising of Joe Biden as kind of the figure that all Americans want to see lead us out of this. This was a vote against Donald Trump for a bunch of different grievances in different parts of the country. But here's the important thing. What that represents is that there is still a cohesion to certain Republican ideals, the Republican platform, even to some of the things Donald Trump has done or not done, that people are enamored by. And to gloss over that schism or to gloss over that cultural dissonance would be to all of our perils. I read something recently, I can't remember who put it out, but the title of the article was The Middle Finger Election. And in so many ways, Donald Trump has kind of represented, and right now Republicans in some ways represent this form of grievance politics, matched with working class policy and deregulation, that is tantamount to giving the electorate a platform to express their middle finger to the industrial and political class. Love it, hate it, whatever, however you feel about it. That's kind of been the platform, and the fact that exists, I think, and has gotten stronger, will continue to get stronger, has really big implications for both parties. I'll just say the ones I think for Democrats really, really quickly. I think Democrats probably are relying way too much on demographic change. Dave, I think you said it a minute ago.
Yeah.
It's always kind of been assumed that if you have more people of color in a community, that's going to go to the Democrats. Well, this election completely disproved that, showing that it turns out that not all Hispanic or Latinx voters are homogenous. That Black men see something in the president that nobody thought that they would. Demographics is not the destiny we kind of thought it was. I wouldn't look at Arizona and Georgia as being emblematic of changing demographics. I think it's less about that and it's more to do with some of the other things I referenced. Democrats are losing the misinformation fight. Republicans have perfected, and I shouldn't say that generally, having been a Republican at a moment in my life, I don't think Republicans as a party are willfully introducing misinformation, but there's a lot of misinformation coming from stronger conservative platforms. And I'm not saying that to fight that there needs to be stronger platforms on the left, but there is a misinformation battle waging in this country right now. And there's waning confidence that social media companies have the capacity to police it, and there's an erosion in trust of the government to police it. And that's a huge problem for us. And the third thing for Democrats, I think, is that the policy agendas of the past do not resonate with so much, and Dave, you said it earlier, the working class voter today.
Yeah.
And I think that's why you have seen a shift in working class sentiments in recent years. So there's a lot to unpack. I am deeply worried about the next few years. If Joe Biden can be one thing, it would be, my wife used the analogy the other day. She said, after 4 years of a pretty brutal political environment, Joe Biden is kind of like the equivalent of a really bad breakup and just putting on your sweats, your stretchy pants, and eating a pint of ice cream on the couch. Like, Americans just need to put on their sweats and just take a breath. But we have a really long way to go, I think, over the next few years, because this dissonance it's profound, and it wasn't caused by Trump. It existed well before Trump.
Yeah, no, he's more symptom than cause, although he's also accelerant. Well, Biden's granddaughters say he likes ice cream, so maybe that's a good analogy. Just a couple of thoughts, and then I want to get into a discussion of equity, which is, I know, a topic you all care a great deal about. One, I actually believe destiny handed Donald Trump his future with COVID. All he had to do, kind of to David's point, was be adequate at managing the disease, and then he would have become the president who saved us from COVID. Instead, for whatever reasons, he chose to, kind of fight it, downplay it, promote false narratives. And we're paying an incredible price as a country. And despite that, he still got over 70 million people to vote for him. So there's something going on. And if you look at the last 20 years, productivity and median household income, which before that time went together in lockstep, when productivity increased, people made more money. Makes sense, right? But starting around the year 2000, productivity has continued to increase anywhere from 1.5% to 2.5% a year. And median household income on an inflation-adjusted basis is actually flatlined. And I think you can look at that and begin to understand why the American people are as angry as they are. And in that sense, I don't think the Tea Party, I think the Tea Party and Trump and Occupy and Bernie Sanders are just different sides of the same coin. People are working harder than they've ever worked before and have less to show for it. And that anger has different ways of expressing itself. And I think we're feeling that throughout 2020 in fundamental ways. And there are two macro forces we're wrestling with as a society that are pretty unique. The first is we're going to be the first pluralistic democracy in the history of the world. It's never happened before. California's already there, and honestly, if you look at what California was going through 25 years ago with immigration and so on, that was a precursor of what we're going through as a country right now. So that, and we've mentioned race a few times here, you don't have to dig very deep into any part of American society, history, culture to hit race as an issue. It's been our Achilles heel right from the very founding of the country. And honestly, I hope in the future we don't end up in a place where we tell somebody's political affiliation by the color of their skin. And I'm actually a little bit encouraged that the populists surprised us a little bit on that demonstrated that people are thinking on their own and coming to their own conclusions. So first, kind of a pluralistic society. And then the second is, for the first half of the 19th or the 20th century, the 1900s, we saw income inequality decrease. We saw more cohesion in American society. And then it started to reverse in the 70s, 80s, to the point now where today we have the same level of wealth inequality and inequality generally that we had during the Gilded Age before the progressive movement in the early 1900s. And so how we come to terms with these two macro phenomenon, living in a pluralistic society and addressing gaping wealth inequality, I think are going to define the next 10, 15, 20 years of our politics. And it can go one of two directions. And I think that's kind of what everybody's feeling. So so with that, and this is a healthcare panel, let's talk about equity. And if COVID-19 has shown us nothing else, it's that the fragmentation and the inequitable access to healthcare has profound consequences on lower income people, but also has made us realize, if we hadn't before, is that one segment of the country gets very sick, we all get very sick. So the linkage of the economy to the spread of the pandemic, absolutely profound, and our underinvestment in public health. So you kind of put all of that together and say, kind of through hard-won wisdom, drop by drop, is that it's really a national priority that we provide adequate and affordable healthcare to everybody in the country. So where are we in that journey, and what makes you optimistic? What makes you pessimistic? David, why don't you go first?
Oh, dang it.
Yeah, you got to think last time, and you got to keep your answer shorter this time too. So
yeah, I will. Well, that won't be a problem. We're not anywhere close to where we need to be, as you indicated. Disparities, economic, health, and the like just continue to grow unabated, and I don't think there's a lot of reason to be confident that federal government is going to be the entity that helps build a grand coalition to lead us out of this. What I do get optimistic about right now is, for the first time in decades, you've got CEOs all over our industry saying words like social determinants of health as if it's some new catchphrase. And you be pejorative about that. It's a 100-year-old term, but the fact is they're saying it, and it's being discussed, and it's being linked through data to physical health outcomes and claims impact and all kinds of things. We're starting to create a business rationale around health and equity. Businesses this year, I think, have begun to reframe their corporate responsibility in the context of equity as well. Because the race discussion we've had, I think there's a sense that we all inhabit symbiotic ecosystems in our cities, and that businesses cannot remain absolved from participating in the kinds of activities that can lift communities up. The third thing that gives me hope for the future, and the last thing is, we have a tremendous amount of resource, venture-backed tech and innovation and public funding and philanthropy. Like we're generally a thoughtful, savvy, compassionate people. We just really suck at putting it all together in service of the underserved, and there are challenges for that. But I also think there are equal opportunities, particularly at the local and state levels, to be much better at this than we have been, especially as we all feel the pain of this, the budget climate we're walking in.
Yeah. Looks like Stephanie has volunteered Vikki to go next. So,
Sure. I mean, I think, I don't think we can get to racial equity without having a really strong base of coverage. So a lot of it does come back to continuing the ACA, and frankly, to get the remaining states to expand Medicaid, which is key to providing a foundation for health coverage in the United States, and is just the gaping hole in our.
You think that'll happen?
I mean, it is happening, maybe not as fast as I would like or others would like, but look at the states that have moved forward in the past few years. Look at the ballot initiatives in Missouri and Oklahoma. That is progress. And hopefully there'll be, additional progress going forward. On racial equity, I hope that all of these organizations that are committing to racial equity in June of 2020 are as committed in June of 2030, and that we've made real progress. In other words, I think that there is a moment to leverage and commit, and it needs to be a long-term commitment because we have a long way to go in figuring out how to really serve communities that have been underinvested in for a long time. I'll also just take the opportunity of having the floor to just respond, and I know we all are here to talk about healthcare, just a few things that David said earlier, where I think we have both agreement and differences of opinion. I totally agree that there's a lot to sort through in the election, and also agree that information and the quality of information versus misinformation is key to getting past some of our divisions as a society. Where I think we see things slightly differently is, I'm not sure it's the case that if Trump had moderated his words, the election outcome, in a few cases, the election outcome would have been different. I see him as someone who really leverages political opportunities in ways that he thinks will motivate his base. So I think it is as likely that in some cases, he was doing that strategically to get out the vote, not to depress the vote. And then I'll also say, although I love the idea of, Biden as a salve, and I do think that there will be relief that we're not all waking up at 6 o'clock every morning to divisive tweets. I resist the image of Biden and his eating ice cream in his sweats, because this guy's already working really hard. He woke up the morning after the election, put his top 4 priorities on his transition website, and started to get to work on COVID, despite the obstacles of Trump being dragging his feet on the election outcome and the transition. So, if he's the couch sitter, he's the couch sitter with the laptop open in front of him and the cell phone in the other hand, trying to right the ship of state.
Yeah.
Vikki, I am not going to jump into a point counterpoint. I do just want to clarify my comment. The comment was not Joe Biden sitting in his sweats. I landed it wrong, so if my wife ever watches this, I'm in really big trouble. America needs to put on our sweatpants and just take a deep breath for a minute. The idea is that we've been waking up at 6 a.m. so tense for so long that if there's return to moderation for a brief period, we all get to take a breath.
Well, I'm right there with you, and I'll take the ice cream too. I'd like to be in my sweat with some chunky monkey.
Great, Stephanie. And I know this is a passion for you, so I'm actually kind of glad you're ending up this round of questions.
The ice cream and sweatpants, or that's also
No, the Medicaid and
Yeah.
equity and
I am in
getting
so
great
much
health care to
trouble, guys.
everybody.
I'm not letting her see.
Yeah, I think Vikki's right on, and that coverage is first. It's not the end all be all to race equity, but it is first. Many very prominent Black leaders and other leaders of color have pointed this out, that it is race equity. Medicaid expansion is a strategy to reach or try to reach towards racial equity. In the same manner, I would mention immigrant communities, which are primarily communities of color, not everywhere, but in Illinois, absolutely community of color. And Black and brown immigrants are treated differently often than other immigrants. So it really is a race equity issue. So expanding Medicaid everywhere, which has now been shown, if you look at any study, to improve health outcomes in Black communities, especially improve economic levels, reduce debt and bankruptcy, and the same will be true in immigrant communities as we expand. And I know that's on Biden's list, as we draw back the restrictions, but also expand opportunities for states to be able to do what Illinois did. When you try to do things like reduce high rates of maternal mortality, especially in Black women and Latina women, Illinois recently, and I know red states and blue states are looking at strategies to do this. And there's some bipartisan agreement in Congress to extend Medicaid for 12 months postpartum, which Illinois just did. It's one of the biggest things that can be done. Provide other birth supports for paid for under Medicaid in order to reduce infant and maternal mortality. We need to make a difference there. There's been, 30 years of strategies. So we really need to make difference there. And Illinois was the first state in the nation to cover children, regardless of immigration status. Some states have followed us. That was almost 15 years ago. We now in May and just starting in December are starting a program to cover over age 65 seniors who are, regardless of immigration status, who are undocumented or don't get covered by Medicaid. As we know, that's a huge COVID racial inequity, especially in Latinx seniors. We're doing that with state money, even though, as you pointed out, Illinois is in quite a difficult financial state, but the governor and the Medicaid agency understand how important it is, especially with the inequities and disparities that population is suffering, to cover them. So that will be a huge step forward for us.
Yeah, well, we have a really good question from Sarabi Bhatt on resource allocation, and I'd like everybody to sort of think about that topic generally. I can tell you, because it's one of my speaking devices, I've asked probably hundreds, maybe even thousands of people if they thought we needed to spend more than 18% of our economy to provide great health care to everybody in the country. And I haven't yet heard a person that said, oh yeah, we need to spend more than that. And yet we continue to increase our spending. So the challenge really isn't a funding question. It's a distribution question. And Sarabi's, I hope I'm pronouncing that properly, question is, how can we improve and align the distribution of resources at all levels, federal, state, local, in a more equitable manner to improve social determinants of health and mitigate the effects of systematic racism? I might just add to eliminate waste and get more return on our healthcare investment for the people in terms of outcomes and customer service and so on. So who wants to kind of jump on that resource question? And the fact that we overspend so much on healthcare means that if we can cut the waste, we can start to think about allocating resources in ways that better promote the overall health of the population. How How do you all feel about that? Is that even in the realm of possibility?
I'll jump in and then probably say something Vikki will disagree with, but that's why I love Vikki. One of the things that I think could be good about the environment that we're walking into is that, and I've said it on this platform before, pain is, or the expectation of pain tends to be like a key motivating force to do things that you wouldn't otherwise do. And states are going to be in a lot of pain budgetarily over the next couple of years, no matter the best or worst case outcomes. I think states play a critical role in this resource allocation question because states control so much of a funds flow from social programs to Medicaid and other resources that states are going to have to engineer different ways of solving for their own budgetary challenges and limitations. And I think that's going to necessarily mean being more thoughtful about how to consolidate, or at the very least, coordinate different initiatives and efforts that impact a person's whole health at the government level. And then as those funds are distributed, ensuring that that level of coordination sits further down. I think that means managed care organizations are going to have the bar raised in the coming years. And I think there's going to be a much higher expectation by states that when and where those funds go out the door, there is a different cohesion that exists on the ground that is whole person oriented.
Good. Well, Vikki, you taking up the challenge? And by the way, back to ice cream, you can tell by David's shirt choice, his favorite flavor is strawberry, obviously.
So I mean, I love the question about resources, because if you step back, it's really clear, David Johnson, as you noted, like we spend a lot of money, right? We tend to spend it on very expensive healthcare services, right? And you can like drive through, many cities in the United States and see one hospital after the other. And they play important roles, don't get me wrong. But at the same time, we have communities where if you drive through those, it's really clear that there hasn't been a lot of investment. David Smith has had a great framing in some of our work on the Medicaid transformation project about just the stark differences in life expectancy if you drive from one part of the Chicago 3 miles down the road to another part. It's just, there's a lot of inequity. I think what I struggle with is I feel like we have neither figured out the right way to invest in the disenfranchised community and how to move the needle. Although there's promising models like community health workers and peer supports that we could start pursuing today, we've also not figured out how to go at the expense that's concentrated in some of these big systems. And there's no puppeteer behind the scenes that can move resources from one to the other. That's just not the way the system works. It's more complex than that. I agree with David also on the role of states being fundamental to just about everything. One of the things that surprised me this year is the reluctance on Congress's part to support states in the time of COVID. We saw, a big infusion of fiscal relief early in the year, including through Medicaid, through automatically increasing the federal share of Medicaid, which for the past several recessions has been a very successful automatic stabilizer. But, starting in July, as we talked about the next round of COVID relief, there was a distinct lack of sympathy for states and for governors that I really found surprising, and that I hope we can get back on track, because I think in order for states to play the type of role that David wants, which I agree is important, the federal government really needs to step up fiscally.
Yeah. Stephanie?
Yeah, I think one of the things that the participant was asking was about the social determinants of health and what does work. And I agree with you, Vikki, we may not know exactly what works to bring equity and reduce disparities, but we do have something that we know work that I think housing is always primary. And I think Medicaid is starting. And I know Illinois has a new 1915 state plan amendment that is going to work a lot on getting Medicaid money for supportive housing. So I think housing is always key. Income and jobs. So healthy workplace and having paid sick time, as well as predictable schedules and basic income. There are some really interesting basic income projects. One of them is going on in Chicago right now, in Chicago and in Texas, funded by a social incubator in California, looking at basic income as a way to reduce a host of inequities, both economic and health. So I think social determinants of health, even though I know we've been saying those buzzwords for so many years, as you said, I think we do know some things that work, and housing and income are extremely important, even in the segregated city that we live in. Yeah.
Social care is healthcare as well, right? Sort of like you can't separate physical health from mental health. It's health. The fact we do these things is really kind of stupid. In fact, I sometimes say fragmented is just another word for stupid, and there's a lot of that. Anyway, this has been fun. We've barely scratched the surface, but we're actually at the point where everybody gets a final word. And I might note one thing we really haven't spent any time talking about is technology and the potential for technology to fundamentally change some of the business models and provide better outcomes at lower costs. But anyway, we'll save that for maybe another panel. But any last thoughts? Vikki, why don't you start, and then we'll go to David and give Stephanie the last word.
Sure. I feel like we didn't quite get to some of the points David made early on about some of the things that have moved forward administration to administration and could continue. The focus on delivery system reform, interoperability. I mean, there's been a lot of progress kind of, under the hood of the healthcare system that I'm certainly hopeful will continue. And I think particularly on the delivery system reform side, there's a real opportunity to bring a racial equity focus to it. I would love to see the next Innovation Center iteration have a real focus on how do we build systems that meet the needs of disenfranchised people.
Yeah, really go for scale, not demonstration projects. David?
Yeah, I'm great discussion, Dave. Thanks for moderating, and Stephanie and Vikki, thanks for participating. I just think we're about to live through a really exciting collision of three forces. Economic pressure, those changes to the social compact, and a technology foundation that we've spent the last few years building that allows us to do a bunch of things that we couldn't do a few years ago. And the way in which those changes collide and the implications for the market and how government regulates will really define the next generation of this system. So as Vikki said, there's a lot of great stuff happening under the hood. If we stay out of the healthcare political big tent, I think we can do even more. A lot of it's going to rely on the market. A lot of it's going to rely on the people listening to this call. And how we stitch this together and create a new system that can be more efficient, but also more measured and balanced in how we think about equity.
Stephanie, you get the last word.
Thank you. I know we only have about 30 seconds. I think these are the important issues of our time. I tried to put in chat really quick. Somebody was asking about universal basic income. I wasn't able to get the links yet, but the Chicago study that's being done in Chicago and Texas will be issued by the University of Chicago. And so the results of that, but Vox just did a study of every place that universal basic income is being tried all over the world. And so I do think that is one of the next frontiers in race equity and income disparities, reducing income disparities. Thanks.
Well, terrific, and thanks all of you for a great discussion. It's been fun to moderate, and the time's kind of blown by. So with that, I'll turn it back over to Megan and let her conclude.
Well, thank you, Dave, for moderating this discussion. And thank you to all of our panelists for participating today and your thoughtful contributions. We couldn't do it without your participation. So, and anybody, if you're looking for the recording of this or upcoming events, I encourage you to check out our website, www.hc3.health. Thank you all for joining us this afternoon. Stay safe and have a happy and healthy Thanksgiving. We will see you next time.
Thank you.